Evening, good afternoon, and good morning to everyone who's been able to join this call. I am so happy to welcome you here to a webinar on preparing for results forthcoming from the ECHO trial. My name is Mitchell Warren. I direct AVAC, an organization that looks at HIV and broader issues of sexual and reproductive health and rights, and has spent the last number of years working with many partners, many of you on the phone here, thinking about the ECHO trial and the importance of that trial. And as I say, that's a conversation that many of us have been having for years, and we are soon to see results from the trial. And I'm delighted to welcome you here on behalf of many partners, as you see on the screen. In just a moment, I'll describe who's who, to talk about this really important trial. But first, a couple of housekeeping issues, and then I'll go back to introductions and content. We are keeping this call in a muted mode so that we can record the call. It will be posted afterwards, very quickly afterwards, but we certainly want it to be a conversation. So there are multiple ways to do that. Most importantly, if you're on the web interface, you can type questions into the chat feature, and we will be keeping logs of those as we go. So please do put your questions in as they come up. We're going to go through 4 very brief inputs so that we can then get to a conversation. So we really want to encourage that, even though, as I say, the call is in muted mode. And this will be, along with the slides on the website, as a resource. Along with, you will see on the right-hand side of your screen some additional resource materials that exist. Those are links that you can download after the call along with this, and we hope that people will take advantage of that. And we hope that because the conversation we have today is just one of many to prepare for a trial that has results forthcoming in a few months that you'll hear about. But more than a trial and its results are the implications of those results, what they mean for policies and programs, and most importantly, what do they mean for women around the world. And that's what today's call is about. We don't know the results yet, no one does, but the idea is, how do we prepare ourselves as advocates, as researchers, as engaged sexual reproductive health and rights professionals to really think about what we need to do in anticipation of those results, and perhaps more importantly, what we need to do immediately after those results. I'm delighted to welcome you on behalf not only of AVAC, the organization that I lead, but to welcome you on behalf of FP 2020, Breakthrough Action from Johns Hopkins, and USAID, who are supporting through Breakthrough Action this work. I'm delighted to welcome, I guess, my evil twin brother, Edward Mitchell. I'm actually Mitchell Warren, but that's who I am. But more importantly, you're going to hear in just a moment from Beth Schlachter from FP 2020, Joanne Skinner from Breakthrough Action, Edwin Saram from the Ministry of Health in Kenya, and Jackie Wambui from NEFAC, each providing very different perspectives, but taken together, hopefully, all of those perspectives help us prepare together as a community to act. That is the goal here. We also realize that everyone is coming at this slightly differently. Some of you may know about the background issues and this particular randomized trial that's been going on for a number of years now. Some of you may be coming at this very new and realizing it's a new issue and something to be informed about and be ready for. And that's okay. We hope to level set here so that we're all somewhat closer to the same page going forward into our conversations. First and foremost, I think this issue, and so many of us have said this over the months leading up to this call and many other activities, is that this is really an important moment, not only to think about the ECHO trial or about contraceptive methods or about HIV prevention. This is a moment that we hope all of us will use not only to think about those issues, but to think about the fundamental importance of a women-centered approach to comprehensive sexual and reproductive health. I'm very excited, in particular, to welcome the first presenter, and that's Beth Schlachter, who leads Family Planning 2020. Beth has become a dear friend and colleague, as FP 2020 and AVAC have really tried to understand what it means to integrate and collaborate across these incredibly important issues. As many of you know, FP 2020 has become, in a very short period of time, a focal point for family planning on the agenda, both for advocacy and for data and for decision making, and very importantly, a partner in thinking about what the ECHO results might mean. So I'm delighted. I know Beth is traveling on the way to Addis Ababa in Ethiopia for a meeting of their focal people, but we're so glad, Beth, you could join us while you're in transit, and I'm delighted to turn it over to you.
Thank you so much, Mitchell, and it is indeed a pleasure to work so closely with AVAC and all the partners who are on this call. And I want to send my thanks as well to the many people from around the world who called in to learn more about what we can do through this collaboration to ensure that all partners are doing the work now before the results are released to ensure that we have positive outcomes for women. And that integration of messaging, that using all of our tools to pull together so that we're working toward that same end of ensuring that women have information, they have access to a range of contraceptive options, and that at the end of the day they have the care and the counseling that they need in order to understand what might be a complex message with regard to how they make the choices around which contraceptive methods are going to protect them and allow them to live the lives they want to lead. We know how highly complex access to contraception is. When we partner that with needing to make decisions about avoiding sexually transmitted infection, including HIV, and that's the reality for most women around the world. And then we put in new science, like what's about to come out of the ECHO trial. We recognize that our systems might not be ready for that complexity, and that right now all partners have a chance to work together with governments, with service providers, with all stakeholders to ensure that we're ready for the complexity of the messaging that's coming so that we can advance our responses in a way that will allow women to have the information they need without potential sort of disruptions. So what we're calling for here from FP 2020 is that all partners use this as an opportunity to support governments who are right now forming task teams to be ready to respond to the ECHO trial results, whatever they may be. And so we want your governments to make sure that they are working on this. If there is a task team, find out what that task team plans are, see if there's a way that you or your organization can support their efforts, and then be ready with an understanding of how your organization itself is going to partner to ensure those positive outcomes for women. One of the things that we found is that we see this trial, as Mitchell said, as an opportunity to ensure integration, quality of services, but we also want to make sure that all countries are ready for this and are making plans now. Some countries were pulled in through the ECHO trial, including the 4 site countries where the trial took place. There have been some efforts from WHO and UNFPA to reach other countries where there's a high risk for HIV, for women and girls in particular. But all countries are going to need to be able to contextualize this and understand. So this is really a call to action for all partners on this phone to be supporting governments and ensuring that people are taking this moment seriously and are preparing for the results, regardless of whether you think that your country is at high risk or not. So again, I'm excited that Breakthrough Action is going to be joining this call as well, because they have valuable resources, including a roadmap that they'll be walking you through. But there's a lot more information that's been collected at a website called resultsforinformedchoice.org. There's a library that's filled with links to webinars, printed materials, country-specific information, and so much more. And I'll end on a note that there's been a communications group that's been working on some sort of approaches for messaging that you all can access and use to contextualize within your own country or local environment. It's a starting point to get you thinking about the kinds of things you might want to talk about and to get you started on how you might develop your approach as well. So thank you all for your partnership. For the FP 2020 focal points who are on this line or who will be, I hope, watching this recording of this webinar, we look forward to talking about this issue in depth in Addis Ababa next week. There are 18 countries joining us from Anglophone-speaking countries in Africa. But again, this is a call to action for all countries to work together to be prepared. And my thanks to all presenters on the call, and particularly to you, Mitchell, and to our AVAC partners. And with that, I'll see some of you next week, and all the best.
Great, Beth, thank you so very much for that. And I realize in transit is not always easy, but you sounded loud and clear, and we're delighted you could join. And I think the work that Beth's describing, along with what Breakthrough Action is leading and work that AVAC and others are doing, is really about how we prepare for results that provide evidence. Of course, the real issue is action. And how do we act together, particularly at the country and community level, that becomes so very important. And it's really with that in mind that I turn next to Joanne Skinner, who is based at Johns Hopkins Center for Communications Programs and the Breakthrough Action program, where she leads communications efforts around population and reproductive health. And Joanna and her colleagues at Breakthrough Action have done a number of things over the years to think about the intersection of contraception and HIV transmission and risk. Have developed a number of tools because these are very complex issues, and the challenge is how do we ensure that people can act with urgency around these bodies of knowledge and this information. And Breakthrough Action has really been a pioneer in this work. As Beth said, a lot of our efforts now are getting ready for a roadmap for those results, and really particularly at the country level. How will countries, ministries, implementing partners, health providers, and again, most of all, women and men in communities understand and act? And the roadmap effort that Joanna and her colleagues have put in has been Herculean, and I'm delighted, Joanne, to welcome you to walk us through where we are and where we need to go next.
Great, thank you very much, Mitchell, and hello, everyone. In this presentation, as Mitchell said, I'm going to be sharing information about a new tool that's in development, a country roadmap to help governments in preparing and responding to the ECHO trial results. This roadmap is being developed under the Breakthrough Action Project, as Mitchell mentioned, which is USAID's global flagship on social and behavior change. We're in the process of sharing the tool for stakeholder review so that we can be sure it aligns with other processes, including WHO's work in helping countries prepare. But we thought it would be helpful to let people know it's coming so that the community is aware of forthcoming resources on this critical issue. So first of all, let's consider why. Why use the roadmap? Well, as Mitchell and Beth have mentioned, we know that the ECHO study will provide scientific evidence about women's contraceptive and HIV prevention choices, and this evidence can be used to inform national policies and programs. But the evidence and its implications are complex, as we've said. Fortunately, governments have some time before the results are released to get ready, and this early preparation will help governments avoid panic, deal with potential alarming headlines in the news, and adequately plan for potential programmatic and policy changes. Regardless of the results, there is a pressing need for additional investment in programs that expand women's options for contraception and HIV prevention. The bottom line is really that women must have the information, knowledge, and ability to make the best choices for their health, and we can act now to help ensure that. But why act now? Why not wait? Well, given the potential impact on women's health and the potential impact on family planning programs that governments have worked so hard to build, it's important for governments to have a plan in place and be able to adapt quickly once the results are known. As this slide notes, imperfect action is better than perfect inaction. The point being really that by taking the time now to prepare, governments will have a greater chance in delivering an effective response when the results actually come out. So the roadmap's intended to make the process of responding to the ECHO trial results a little bit easier by providing a quick start action plan that can be adapted to different contexts and needs. And I'll note here that we're planning to translate the roadmap into French once it's finalized. The roadmap's organized into 3 key timeframes: prior to the release of the ECHO results, so that's between now and July 2019, after the release of the ECHO results and any WHO interim guidance, so that period is anticipated to be July to August 2019, and then after the release of WHO's final guidelines, which are expected in August, so this period covers September 2019 onwards. We suggest that users complete the roadmap in phases, focusing immediately on the first phase to ensure preparations are in place, and then moving on to other timeframes. So the roadmap, therefore, doesn't need to be completed all at once. The roadmap was developed for national governments to use and adapt, and I'd like to note that it is best if adaptation and planning is conducted in consultation with key national stakeholders, including civil society advocates, donors, and family planning and HIV implementing organizations. So next up is how to use it. Here are 6 key steps we recommend to start the planning process, and I'll go through each of these in turn. First of all, many countries have started or plan to start an ECHO task force or steering committee, as Beth mentioned, which WHO has been supporting. This task force will help ensure collaboration and coordination of actions and messaging in response to the trial results, and is an ideal group to review, adapt, and implement the roadmap. The second critical step is to conduct scenario planning. The roadmap includes potential result scenarios that governments can consider as they conduct their scenario planning. It's important to note here that this process can be very time-consuming. The trial is complex and there are the potential for several different result scenarios. For each scenario, there's a lot of discussion needed to ensure essential stakeholders can come to agreement on the implications and the country's plans for how to respond. Spending the time now to think about these up front will allow countries to move swiftly once the results are released. So the point here is don't delay this step. Thinking about the scenarios now is critical. As such, the roadmap includes a template that helps users think through each scenario, including programmatic implications, potential programmatic strategy, MOH government decisions, stakeholders, communication strategy, and potential communication messages. Once you have thought through the different scenarios, you can think about the primary and secondary audiences that need to be reached as part of the response. The primary audiences suggested in the roadmap include policy decision makers, implementing partners and civil society organizations working on family planning and HIV, sexually active women and girls considering or currently using hormonal contraception who are at high risk of HIV, and I'd like to note here the importance of specifically addressing adolescents as part of this audience, family planning providers, and community health workers. And so note here that these audiences may need to be finessed once the results are released. For example, to focus on women and adolescent girls using a specific type of contraception. For secondary audiences, we suggest district officers working in subnational government offices, professional associations for providers, male partners, religious leaders, and importantly, journalists and other media influencers. And just a reminder that the perspectives and experiences of women and girls who will be affected must be at the center of all decisions and all messages. This is essential to keep in mind as governments or task forces work through scenario planning and the various programmatic implications and messages associated with each potential scenario. So the next step is to review and adapt the goals and objectives included in the roadmap. These include objectives for 3 different timeframes. Here are just a few sample objectives that are included. For example, finalize scenario planning by June 2019 that outlines key decisions and messages for each possible trial scenario. And once the results are released, briefing journalists with accurate information within 1 week following the ECHO trial results release, and increase the number of providers who have the capacity to accurately and effectively convey information to their clients within 5 months of updated national guidelines. There are others, and of course users can adapt and add their own. The 5th step is to review the action tables for each time period and adapt as necessary, and this is really the heart of the roadmap. For each of the 3 time periods, the roadmap lays out actions in 3 sections. Actions that are critical, actions that are important, and actions that are good to have. And this is intended to help guide planning given different country needs and contexts and resources available. For each action, the roadmap guides users to insert the target audience, the person group responsible, collaborating partners, resources required, existing resources, and time frame. And suggestions are made in some places, but intended only as that and can be adapted. Users can also add additional actions that they think are necessary. It's important to note that dependent on the results of the ECHO trial, some of the actions that are included for after the release of the ECHO trial results or WHO guidelines may not be relevant. So each country must assess the specific situation as well as the trial results and WHO guidance or guidelines to determine what is relevant and important to complete. The final step in the planning process is to ensure the roadmap is validated by the ECHO task force to ensure widespread buy-in and a coordinated response. So this just gives a quick summary of the number of actions that are included in the roadmap for the different periods. As noted, these will of course vary based on country adaptation. In total, there are 38 activities and 10 materials. But it's our intention to help with these activities and materials as much as possible. And as such, we're developing or collecting tools that others have developed, a series of templates that can be adapted. So the first of these that will be a scenario planning template, a goals and objectives template, and a task force terms of reference. And more templates will be added on a rolling basis. For example, Breakthrough Action is also developing several resources over the coming months, including an HIV risk assessment tool, a training package for providers based on pilot trainings conducted last year in Tanzania, and job aids and materials for providers and clients. And all of these are intended to be adapted for different country contexts. I also want to highlight that there are other supporting tools and resources that countries can use in their planning and response. Not everything has to be developed from scratch, and we provide links to these in the roadmap. For example, CCP developed a global strategic communication framework that will be updated for ECHO this year. The ECHO Consortium has a fact sheet and PowerPoints that can be used. The Planning for Outcomes model is an interactive tool to understand the potential impact of a change in injectable contraceptive prevalence. And AVAC has a resource to help advocates understand some of the key issues. And WHO is creating a message deck that can be adapted for different contexts and purposes, and will also be supporting countries directly over the coming weeks. So lastly, I'll leave you with the URL of the website that Beth mentioned, and we created this website to make resources available in a central location. So resultsforinformedchoice.org is a place where anyone can go to see what materials already exist. We'll release the roadmap here very shortly once it's been through review, along with the templates. I encourage you to share your roadmaps and other materials here, so there are opportunities for country-to-country exchange. And there will certainly be additional actions that countries include. These could be useful for other countries to know about as they conduct their own planning. And so it's really intended as a resource to help knowledge exchange and knowledge sharing. So I'm happy to answer any questions during the webinar, but please also feel free to reach out to me directly afterwards, and my contact information is provided here. Thank you.
Great, Joanna. Thank you so very much. A terrific presentation, and these slides, for everyone's benefit, will be posted along with this recording of this call shortly after we finish. And then, as Joanna described, the website really is a fantastic clearinghouse where materials are already available, and the roadmap that she described will soon be available. So thank you so much, Joanna, for all of not just this presentation, but all of the work behind it. I know there are questions already coming in, and we will get to those in just a few minutes. But first, as we've all said, Joanna, Beth, and I at the outset, while there are research activities and data being generated and global conversations, some of the most important things that need to happen in the preparation for the results, and most particularly after we see those results later this year, are really at what happens at the country and community level. And I'm delighted to turn now actually to Kenya for our next two presentations. First, I'll turn to Dr. Edward Saram from the Ministry of Health in Kenya, and he's the family planning manager there. And Kenya has really distinguished itself in so many ways as what we think of as an early adopting country across a number of public health issues. And so I think many of us will look to Kenya, which is one of the 4 countries hosting the ECHO trial, to understand how a country will very quickly act on evidence coming from a clinical trial and translate that into policies and programs. So welcome, Dr. Saram, and the phone line is yours.
Thank you very much. Are you hearing me?
Yes, very well. Thank you so much.
Thank you very much. This is Dr. Edward Saram from Kenya. I'm the manager at the family planning program in the Republic of Kenya, and I'm quite conversant with what exactly is happening with the expected WHO ECHO results. And on this note, I would like to report to you that from what the previous presenter has presented on the roadmap, I think we are not far much. We are almost on the track. I want to report that Kenya, when we came from Zambia, the WHO stakeholder meeting, then we actually started the preparation. And right now, I can report to you right now that we already have the ECHO task force members who comprises of family planning program and HIV program in Kenya, and all the interested development partners in Kenya. We have a total of about 21 members, and these ones have been actually nominated by the Director General of Health in Kenya. We've already had about two meetings, and in fact, as I talk to you right now, we are going to have a meeting tomorrow and the day after, that's on Wednesday and Thursday, and we've already have the terms of reference for the group, which includes almost like about 15 tasks, with of course several deliverables, because the deliverable at the end of it all is that there has to be appropriate messaging and communication strategy, because now we are now looking at the possible three scenarios of the WHO results. That there is no, the evidence does not make any change. That HIV prevalence in DMDA, IM, in implants and IUCD is the same. Of course, if that scenario will come in, then it will be there. But however, in Kenya, the women, half of the women who use contraceptives use DMDA, IM. And if this one, if the trial actually shows that there is increased acquisition of HIV on this particular cohort, then it will definitely affect Kenyan women. So we are prepared for the three scenarios. There is no effect. The data does not point to any increase in HIV, but the other one is if DMDA is affected, or the implant, which is actually the second most commonly used contraceptive method in Kenya. So we are now from tomorrow we are going now to look at the three scenarios. If this scenario comes in, what is going to be our message? And of course, the message will have to be from the country perspective. And of course, now this messaging has to be delivered to the Director General of Health and more so to the Minister of Health in Kenya. So those are now the issues which are now going to do. The other one is, of course, we already now formed a subcommittee in the task force who are now going to deal with communication strategy and messaging for this particular task. Point number two is to sensitize. We have already sensitized the national leadership, and we are now embarking on we're going to sensitize. First of all, what we have done as a task force is to come up with a work plan. We already have costed time-framed work plan, which runs all the way up to the end of June when the results are expected, and thereafter, what are we going to do if the ECHO results will not is going to affect one of the contraceptive methods. So we shall also, therefore, from the national level, we are going to sensitize the whole country. And the whole country, we have a vote for 7 counties. So we expect to have a meeting with them. And then from there, we now sensitize the service providers, because they have to. Like now in Kenya, family planning services are offered by nurses. And therefore, we have to make sure that we sensitize them and deliver appropriate message for them. Because when the results will be announced, definitely, everybody will hear it, and there has to be some form of approach. The other one, of course, is to sensitize the other leaders. We are talking about the other stakeholders, including religious leaders. And so that when these results come, it doesn't get anybody who is not prepared. So the issue here is sensitization, developing the messaging, and making sure that everybody else is involved, because we know very well that if the result is interpreted in a certain way, then definitely it's going to affect. In Kenya, we've made several progresses in terms of right now our modern contraceptive prevalence is about 6%, and even though we had a target of achieving 66% by the year 2030. So the issue, therefore, is now we are on course, and the task force members were drawn across the board. It was something which was agreed, and we hope, therefore, that by the end of it, in the next 1 month, we will be having clear messaging, and we will be rolling out sensitization and putting up and getting the committees to make sure that the commodities, with the commodities, we'll have to wait until when the results are announced so that we know if there is any of the commodities which is affected, then what are we going to do? I think that for now we'll have to wait until when the results are announced. So with that, I think the consultations are going on, and we have prepared for eco-resource. Thank you.
Great, Dr. Saram, thank you so very much. You have quite a busy portfolio, and we're really delighted that you could join us and share that. And you know, it's exciting thinking about Kenya in that the ministry's leadership and work will be enormous. The great news is that you all have many partners there, and I'm super excited to welcome our next speaker, who is a dear friend and colleague over many years, although she's much younger than I am. Jackie Wambui, who is currently the Advocacy and Communications Program Officer with the National Network of People Living with HIV and AIDS in Kenya, but does so much more and has done so much more over the years. And we worked very closely when she was an advocacy fellow here at AVAC. She's also been just a pioneer and champion in advocacy over the last couple of years related to a separate issue entirely about HIV treatment access, particularly for women in Africa, and the challenge of really bringing women front and center to that conversation, working with partners and implementers and ministries of health. So her history is incredibly strong to help us navigate through the ECHO result. In addition, she is one of the members of the Global Community Advisory Group of the ECHO trial, the GCAG, that has really helped provide insight and support to the trial as it has been going forward these last several years. So Jackie, I'm delighted to welcome you, and I'm delighted to hear your perspective on planning for the road ahead.
Okay, Michelle, thank you very much. Can everybody hear me?
We can hear you, Jackie. If you could speak up just a little bit, please.
I speak up a little bit. How about now?
Perfect, thank you.
Okay, so thank you, and yes, this is me, as Mitchell has given me a very nice introduction. So as he's mentioned, I am a Kenyan citizen living in Kenya. I'm also a woman living with HIV, and I work for the network of people living with HIV in Kenya, and I'm also a member of the Global Community Advisory Group for the ECHO trial, which is a group that we formed with the representation of women in the different ECHO trial countries, which would be Kenya, South Africa, Eswatini, and Zambia, and also Zimbabwe and Uganda. This is a community advisory group of a special of its kind, because most community advisory boards are formed within the trial site. But the unique thing about this one is that it's an African woman-based community advisory group. And we felt this was important because we really wanted to emphasize that women should be at the center of this trial, and also it's the dissemination of the results, and of course what will come going forward. So my presentation will just be on the sort of work that the GCAG has done, and then also just a little about what has been happening in country, which I just add on to what my colleague Dr. Edward has given. So the recent work that we've done towards ECHO as African women is that in the year 2018, 4 countries, which is Eswatini, Kenya, South Africa, and Zambia, we held 7 meetings, 1 each in Eswatini and Zambia, 2 in Kenya, and 3 in South Africa, mostly because South Africa has most of the sites. And then altogether, we were able to reach roughly about 225 participants, 25 plus in Eswatini, 50 plus in Kenya, and 125 plus in South Africa, and 25 plus in Zambia. And when we were holding these consultations, we looked for women across the board, young women. We looked for women who are sex workers, women who are, what they say are mainly vulnerable to acquiring HIV. And these women, we brought them together because we wanted to know what is it exactly they know about the ECHO trial. And once they know what they know, what it is that they are expecting from the trial, and also what it is they want to hear when the results are out. So really we are focusing on what kind of messages would they want to hear, and how do they want these messages to be rolled out. And then those consultations were very successful. We had a lot of feedback, and coming on to that, we had a multi-country women-only consultation in Lusaka, Zambia in February 2019, which we held it prior to the WHO planning meeting in Lusaka, which was together with other stakeholders across the board regarding the ECHO trial. And we have also been participating in planning meetings convened by WHO, which was the one I mentioned in Lusaka, and also meetings that have been convened by FP 2020, which was held in April in Washington, D.C. And also we had a communication professional meeting in April in New York City that was convened by AVAC. So what is it we are saying now in all these consultations and all these meetings? Women, as we are, women living with HIV, women who are said to be most vulnerable to HIV, we are demanding a woman-centered approach. No either or, just a women-centered approach. And then no either or calculations that weigh HIV versus pregnancy risks. We also demand full information about the risks and benefits, and we demand to lead on planning for the response. Because most times when programs or policies are being made for women, most of the time women are not in the lead, are not even in the creation of it. We are usually put at the end when it's time to come for dissemination. So we are asking to demand, to lead on the planning for this process. And so going back to Lusaka in February 2019, we African women presented a statement that we call the Every Woman Matters. And this statement actually just spoke about the things that, that we feel should be there, the things that we affirm, the things that we demand from the different stakeholders, which includes the funders, and it also includes the WHO. That statement, I believe, has also been shared with the people who are on this call. And then the important thing we want to emphasize is that why does it matter? There's a big struggle to center health services on women and girls' needs and their priorities and lives. It's all ongoing. So this trial will allow us to inform and advance this struggle. But then again, it won't happen automatically because we've been having various issues, like Mitchell mentioned how I've been doing a lot of advocacy towards treatment. And most times when this treatment comes to the end user, it doesn't involve the planning and the like the process of that end user getting that project. So we are really emphasizing that we'll be able to now the trial will allow us to inform and advance on this struggle. But then again, it won't happen automatically. There's a lot of misinformation that can prompt women to stop using or having access to methods, to contraceptive methods that they need. And then again, a clear finding will be costly to act on, but then action is key. So with all these things that is in the back of our minds, we feel that is very important for civil society advocates to continue working on women's sexual and reproductive health rights, and to continue to share information within networks, to provide input, international task forces, and to conduct community dialogue. So as Dr. Serem has mentioned, the task forces have been formed in various countries, and Kenya being one of them. As he mentioned, it was almost like one of the countries that was to set it up immediately. And the process has been going very smoothly, and like he mentioned to you, that we'll have a meeting tomorrow. So in this task force, of course, we are planning to adapt messages and materials that will prepare now the various stakeholders for the trial results, especially the women. And of course, these guidelines we're also asking from the WHO. So what we are saying that needs to happen, like after the results, before now the guidelines come out, which, of course now after the trial, the guidelines from the WHO will have to be updated. We are asking for clear communication from WHO, national and subnational governments about results, implications, and next steps that center to ensure women's right to informed choice. If the woman doesn't have an informed choice, she won't be able to make the right decision. And if she doesn't make the right decision, again, it will turn out that, everything didn't work out the right way. And then again, we are also, planning that women, civil society will share information and shaping to change the agenda. And then, of course, now the after, like depending on what the results will show. Again, like we may need to have like some changes in procurement, because again we have this huge unmet need of contraception services in Africa. We also have the huge unmet need of the integration between HIV services and the sexual and reproductive health services. And also we are seeking, like programming messages that will result in more choices, so that women will be able to make more information, to make informed choices by the women having like access to information, especially within the young people and adolescents. So that is all I have. That's all I have for today. And of course, I'm welcome to take any questions.
Fantastic. Jackie, thank you. And thank you, Beth and Joanna and Dr. Serem as well, for terrific inputs. A number of questions have come in, a couple that I think have very quick answers, which maybe we'll get to first, and then we'll open it up for further conversation. Please do feel free to continue to put questions in the chat boxes on the screen, and we will get to those as best we can, and I have a few others that had come in. First, a very practical one, Joanna, for you. You mentioned that there'll be a French translation of the roadmap. People wondered when that will be available, and also if you could have a sense of even just the English version, when you think that will be available on the Results for Informed Choice website.
Sure, thank you, Mitchell. So I think we're hoping that the English version, once it's gone through review this week and some final revisions, will be available in the next 10 to 14 days. And we'll have it translated into French immediately. So hopefully within another week to 10 days to turn around that French translation and do a quality check.
Great. That's super. Thank you. And then a couple of questions about sequence and timing. Maybe just to clarify, I know different people have been on different webinars that have been discussed about the trial. Several of you heard just on this call, a number of people mentioned a meeting in February, and that was the World Health Organization's meeting in Lusaka, Zambia for, I believe it was representatives of 14 countries, both ministries and civil society, as Jackie said. Coming out of that, countries were asked to put together task teams as Joanna described. The trial results are anticipated in the middle of July, so just over 2 months from now. And then just to clarify, I think something Joanna said, that WHO has explained that they plan to have a meeting at the end of July of a committee that they will create to review, that will then feed into their guidelines review committee, a formal structure that will have a meeting later in August, after which they will put out new guidelines, and that's why Joanna was describing the July to August period of waiting for those guidelines, and then those should come out by the end of August from WHO, and then it becomes life after guidelines, we think, in September. So just to help people understand that. Coming out of Lusaka, different countries began a range of processes, as both Joanna and Dr. Saram described. But Dr. Saram, a question for you. Kenya was actually the first country to host a task team meeting immediately after the Lusaka meeting in February. And someone asked a question, do you have any tips for your colleagues in other countries who are just starting the process now?
I didn't get the question clearly. Maybe please, perhaps, can you repeat?
Sure. Sorry, Dr. Sam. A question was, what suggestions or tips might you have for countries that are a little behind Kenya in setting up their task teams? What would you do? What would you recommend to other countries as they get started?
Oh, well, thank you. Thank you for that question. Since you have to have a team to work on to lead in preparing the country for the eco result. On this, it has to have a team from the family planning community and the HIV community, because it affects. I mean, the two programs either way are affected. And so my advice is get a team. It should not be more than 20 people. And then get the references, and then you lay a work plan, because we are actually having less than 8 weeks before the eco results. So time is not on our side, and if I mean, the result can come in either way, and if the country is not prepared, then you actually get a danger of losing the gains which have already been made in family planning. And you know, for development of any country, family planning has, I mean, the family planning program has to be robust, because we are aware about, especially in Africa, about our poverty. That if we don't check our growth rate, then we are we can easily slide and go into and increase the poverty levels. We are looking at their development. So we know very well that in the world there are anti-contraceptive groups
Great.
who don't want who don't want women to use contraception, and we have to be wary about that. Thank you.
Great. No, thank you. That is super. And let me turn to you, Jackie. A couple of questions have come in, but both about some of the specific civil society work you're doing in Kenya. But in addition, someone asked, do you see the preparations around ECHO as an opportunity for further coalitions and collaborations between local women and global health, and between contraception, sexual reproductive health, and HIV? So can you talk a little bit about what's actually happening and the opportunities for possibly larger, longer-term relationships?
Okay, thanks, Mitchell. Just to emphasize what CSOs are doing in Kenya in preparation for the results, like I mentioned, with the support of AVAC, we have been able to do several in-country consultations. We did one in the city of Kisumu, which is actually a city which is like where the trial site is the ECHO trial site is happening. And we were able to consult with these women and ask them, like, you know, like the various things that I mentioned, like what it is they know about the trial, and once they know what they know, what it is they're expecting from the trial. And again, depending on the trial results, what kind of messages do they want to hear? And then we did another one for the same in Nairobi. And the one for Nairobi actually was very interesting, because that way we were able to combine both what we call the family planning world and then also the HIV world, because we noticed that both the trial affects both communities. So also in Nairobi, we asked the women the same questions. We had various stakeholders, and we were able to have a very fruitful discussion on that. And in terms of further collaboration, like I said, this is a very, very fantastic opportunity for us to talk about and to think about and to work on the unmet need for family planning, especially for access to women in Africa. And also, it is a very great opportunity for us to talk about the long-awaited integration for sexual and reproductive health and HIV. During these consultations, we had a lot of talk amongst young women talking about how you will go into a facility and you're not able to get the services at the same time or on the same day or in the same area. So this is a great opportunity for us to talk about this integration. And then also for me to emphasize, like Mitchell I mentioned during my introduction, when we're talking about access to treatment, we're also talking about treatment literacy. A lot of people in the community are not literate about what treatment they take, be it for HIV, be it even for contraceptives. So this is a very great opportunity for us globally to get our communities, treatment literate on both HIV and contraceptives. Yeah.
Great, Jackie. That is super helpful, and I think so important that we think so much about a trial, but you beautifully described the larger set of issues that we all should be thinking about and working towards. That's incredibly helpful. Joanna, a question for you as well. Obviously, there are many different stakeholders involved in all of this. Obviously, the ECHO trial team, ministries of health, civil society, but also WHO. And I know we're all working very closely with WHO, but I wonder if you could describe how the WHO processes are connecting with the roadmap and vice versa.
Thank you, Mitchell. Yes, so WHO are one of the key stakeholders that we plan to have review the roadmap over the next week, and so that we can be sure that it aligns with the processes that they are planning. We know that they are planning to do country workshops after the guidelines are released to help countries work through these preparations. And so we want to make sure that the actions included in the roadmap reflect that process as well. So we will be incorporating any of their comments over the coming week before it's finalized.
Fantastic. I know we're running up to time, and I do want to have a quick a couple of last words about follow-up and a survey, but maybe just take a moment if each of you, I know Beth had to drop, but if each of the three of you, maybe we'll go in reverse order of presenting. So Jackie, Dr. Saram, and then Joanna, if each of you could just in one or two sentences give a sense of your both priority and best hope for the next couple of months. Jackie.
My best hope? My
yes.
best hope is that we'll be able to communicate whatever the results are, however they are, that we'll be able to communicate them quickly, effectively, and in a way that the women will understand. That is my best hope.
Beautifully said, Jackie. Dr. Saram, last thoughts?
Yes.
Any last thoughts? Oh, I was just giving you a chance for any last thoughts of what you hope might happen over the next couple of months.
Our plan for the next couple of months, I think.
Well, what's your best hope? So sorry for the connection. I was asking if you had any last thoughts and what your best hope would be for the next couple of months planning ahead.
Yes, we are actually, as I mentioned in my presentation, that we already have a work plan, Kenya Eco Task Force work plan, which is actually costed and time with the time. So we have a plan between now and the 10th of July, and we are talking about sensitization, getting the messages right, sensitizing the health workers, sensitizing the women themselves, and all the stakeholders. So that's what's going to happen for the next 2 months.
Fantastic. Joanna, any last thoughts for the way ahead and your best hopes?
Sure. I think, having listened to Dr. Sturm's presentation, my best hope is really that we see more countries following this lead and really taking action and having a plan in place.
Beautiful. Perfectly said. Before I close up and thank all of our presenters and all of you, there is a webinar survey that we would love. It'll come up on your screen. There are 4 simple questions. No trick questions here. If you could take the moment while I close out the call to just highlight and vote and score and answer questions, that would be fabulous. There's obviously an enormous amount of work ahead for all of us. I really want to thank all 4 presenters for clarity and urgency in the road ahead. This webinar recording and the slides will be available on the website shortly, along with the resources you see on the right-hand side, the ECHO website, background on WHO's medical eligibility criteria, FP 2020 resources, the Results for Informed Choice website, and a document that we've done at AVAC on anticipating results of the ECHO trial. We'd love your comments. Please do tell us not only if they're helpful, but if there are gaps, other things that you would need and ideally want, that would be enormously helpful. And maybe I'll just say at the very end, in thinking about the future, picking up on something Jackie said and what you heard throughout this call, there is an enormous amount of energy and effort and a need to really plan with urgency and with collaboration. There are a number of partners engaged, and hopefully you got a sense of that on this call, and really wanting to connect those dots. No reason to panic, simply a need to plan with urgency. And just on one of the last questions that was so nicely asked of Jackie about, is this an opportunity for the future? And I think looking back over the last several months and looking ahead, perhaps the most important thing that I've certainly learned is the importance not only that we manage for the ECHO results, but that we see this as an opportunity and seize this opportunity to build an infrastructure for advocacy, for programs, and for policies that put women at the center and reflect a new spirit and passion and action for integration, a word that we've all used many times over the decades, but so often hasn't been the reality for women walking into a clinic or walking into a community center, to understand that there are many choices in everyone's lives, man or woman, but for a woman, many choices of contraception, of HIV prevention, of HIV treatment, of sexual and reproductive health and rights. And it's never just one of those issues. It's how all of those play out in one person's lives, and the support that health systems and providers and partners and peer groups can provide really become essential, something we've all said for a very long time. And let us hope that the ECHO trial galvanizes the way forward so that there really is a new approach to communicating well beyond ECHO and well beyond just those specific issues to the larger needs. So thank you again very much. Thank you for doing this survey. And more importantly, thank you for staying engaged over the next 2 months, and more importantly beyond. It is not a research result only. It is not simply a WHO guideline. It is what communities and providers and policymakers do with that information. That is really important, and that will be work that unfolds over many months and years ahead. And we look forward to strong partnerships with FP 2020, with Breakthrough Action, and with all of you on the line. And please do follow up with any of the presenters about next steps. So thank you all, and I really want to also thank the Breakthrough Action team behind the scenes, beyond Joanna, not only for helping develop the roadmap, but for organizing the logistics of the webinar. And hope you all have either great evenings, afternoons, or mornings, depending on where you are. Thanks so much again, and look forward to many more conversations.